Assistant of the day คุณสุธีรารัตนสิรินทรวุฒิ Please welcome คุณสุธีรา
Hi.
Hi, how are you?
I'm excited to be sharing this story related to the work that I do in the lab. So, yeah.
So what are you going to share with the audience here and the judges?
Yeah, I'm going to talk about the new technology about how we use our own immune cell to attack cancer. So that's a really new and trendy thing right now.
Are you ready?
Okay.
Yes. Please go ahead.
Thank you. Have you ever wondered why, with decades of research, we still can't cure cancer? Radiotherapy, chemotherapy? These rely on one thing, that cancer cells divide more often than normal cells. Blasting them with radiation or poisoning them with chemo drugs. These kill cells indiscriminately. We just hope the cancer cells die more. The problem is, a subset of cancer cells don't really divide more often. These mother cells, or the cancers themselves, also the ones giving rise to other cells in the tumor. So when we use this method, we kill the tumor shrinks, the patient goes home happy, but then a few months later, the tumor comes back. Obviously, this has a problem, and we need a better way to solve it. One thing we already know is that these mother cells, without them, the other cell in the tumor will eventually die off. So targeting these cancers themselves would be a way to go, right? But how? Luckily, this story has a hero. Our own immune cells can have constant surveillance and also have combative skill to fight other foreign things that enters our body. So they have this arm-like structure called receptor that binds cell surface protein and recognize different cells, tell them apart. For normal cells, they have cell signal telling these cells, yo, man, we're on the same side, don't kill me, okay? And these cells would leave them untouched. But for the rebels with corrupted proteins, they're all doomed. But for cells in our own body that have gone rogue like the cancer cells, this become complicated. These cells have mutated protein, but at the same time, they disguise themselves with extra self-signal. Also, the mother cells can also camouflage their surface protein. Fortunately, they can fool some of the newbies, but they can trick some of the veterans who recognize the mother cells even better than the other cells. In this case, when scientists learned about these battle scar heroes, they have a eureka moment, and we utilize how these cells work. So basically, we think whether we can mutate them in a lab, give them superpower, and have super receptor that can recognize the cancer cells and kill them specifically. And that's exactly what we did. We even expand the cells into larger army and give them and train them to be super good at using their superpower, all done in the petri dish. When transferred back into the patient, these cells attack the cancers themselves, and lo and behold, the doctor saw drastic improvement in their chemotherapy response and other responses. So legions of scientists now working on this particular approach, and although it won't be available right away, this new superhero gives us a newfound hope that finally we will be able to eradicate cancer once and for all.
Thank you. Very impressive. What do you think, judges?
Yes, thank you. It was impressive, and I think, like you mentioned, that most people are very familiar with chemotherapy or radiotherapy, and this immunotherapy is new and upcoming. And I think your presentation was a very clear and very well-structured way to explain how this therapy would work. So I think for that, I congratulate you on achieving that mission, and certainly for myself, I have a much better understanding. And I guess what would help or to strengthen the case if there are some examples on the progress that's already been made, and what are the challenges scientists face in widely apply this therapy. I think that would be useful to know. I mean, now that we understand the theory, I think everybody will be curious so how this will be realistically applied to cure cancer eventually. So if there could be more about the progress so far, the challenges facing, what are the key breakthrough we need to utilize this therapy, I think that would help to make the case even stronger.
Thank
Okay,
you.
but overall, very
I'll
good.
try incorporate that part.
Thank you.
Well, I think it's a very good presentation too. Well, I just think that it will help also a little bit if you could have some visual aids or something like that, to because there's quite a lot of story in your presentation, so you have to make it fast and to be for the audience to be able to follow. It would help a little bit if you could have some of the visual aids or some props. I'm not sure how, but I think it would at least keep people in some pictures, and you can elaborate around that picture.
I see. So maybe the receptor and the binding site and all that.
Right, yeah.
It's very informative and new emerging technology for the biomedical fields. Immunotherapy is a new hope to fight with the cancers. I love your story. I would like to suggest about your movement, your eye contact, because you need to see the audience, especially the judges, and make eye contact would be more perfect next time. And sometimes you speak too fast because lots of information. So it would be nice if you can pause before starting the new topic, new story, because you just continue and then you find it difficult to follow your talk because it's quite advanced technologies. As you mentioned about the props, you can make a very nice cartoon or a thing that explain antibody by to antigen or the immune cells, because you brought a petri dish, one petri dish, but you can bring more next time. Your props, your scientific equipment, or any cartoon that improve the understanding of the immunotherapy, and also the take-home messages that people really can appreciate the new technology. Good luck.
Thank you.
Thank you very much. And thank you, judges, too. คิดว่า